Good morning, everyone. Bonjour tout le monde. Thank you very much for being here. We're here this morning to discuss the tabling for second reading of a private member's bill that I've introduced to regulate temporary for-profit nursing agencies. And I'm joined this morning by Dianne Martin, CEO of We RPN, and Dickon Worsley, who is the president. We RPN represents registered practical nurses in Ontario, of which there are nearly 65,000 of them. And We RPN collectively advocates both for registered practical nurses and, just as importantly, even more importantly, the patients that they serve. And today we're here to address the challenge of temporary for-profit nursing agencies. And in order to do that, I'd like to take a moment and set the stage of healthcare in Ontario. We have a healthcare system that is under profound strain, a healthcare system that was brought to its knees by COVID-19 and by Doug Ford. Sustained underinvestment over years. As recently as a few weeks ago, learning that this government is underinvested by $1.7 billion in healthcare. We've had the wage capping legislation known as Bill 124, which has been deemed unconstitutional, and yet this government pursues a constitutional appeal. And then finally, we've had waves of privatization, such as Bill 60. It's not surprising in the wake of those things and so many others that we've got immense problems in almost every sector of healthcare. We have closures of emergency departments, astronomical wait times. We have millions of people who don't have a family doctor or any sort of access to primary care. And we have a massive backlog in the tens of millions in terms of surgeries, diagnostic tests, and medical procedures. And even though that sounds incredibly bleak, could give people reasons to feel hopeless, they shouldn't. Because against that backdrop, we have the never-ending heroism of healthcare workers. Healthcare workers such as nurses, personal support workers, and many other professions who show up day after day to fight for our patients, despite the fact that they're not paid fairly, that they're not protected fairly, that they're not treated fairly, and that they're driven out of their professions. Healthcare workers are the backbone of our healthcare system, and they deserve to be treated as such. But as we see growing numbers of healthcare workers, and especially nurses, getting pushed out of our public systems, we are instead seeing a proliferation of of temporary for-profit nursing agencies. These are organizations that charge our public system 3 to 4 times the normal rates in order to send nurses privately back into the public system. To the nurses, they offer 2 to 3 times normal wages because they are not restrained by legislation like Bill 124. And as we have learned, they engage in deceptive and predatory recruiting practices. I've had the opportunity to see the impact of temporary nursing agencies through my clinical practice and at a system-wide level as a member of provincial parliament and the health critic of our party. But to share exactly how this impacts patients, staff, and our healthcare system more broadly, I'd like to turn it over to Dianne Martin, CEO of We RPN.
Thank you, MPP Shamji. I'm honored to be here today on behalf of Ontario's registered practical nurses, and as you've heard, about 65,000 of them in the province. I'd also like to acknowledge that with me I have one of those great registered practical nurses, Dickon Worsley, our president at We RPN, and a very, very hardworking Emerge nurse. We are here to support this piece of legislation that MPP Shamji has put forward. Ontario is facing a dire nursing shortage, which is having a direct impact on the quality and continuity of care across our province and our healthcare system. Over the past few years, nurses have faced tremendous challenges in the face of the pandemic. According to a recent survey our association did in May, 76% of nurses say they do not have the time or the resources to deliver the best possible care to patients, residents, and clients. Nurses are reporting continuously growing workloads, unmanageable nurse-to-patient ratios, and significantly more stressful working environments. RPNs continue to be vastly underpaid compared to their nursing counterparts. For-profit nursing agencies were initially seen as a short-term Band-Aid solution, but we're reaching a point where the reliance on agencies is diverting money that could be used to fund full-time nursing roles, exacerbating the ongoing staffing crisis. From a patient perspective, this is having a negative effect on the continuity of care as agency nurses come and go. From a nursing perspective, this places nurses at greater risk as they are parachuted into new and unfamiliar environments with limited time to familiarize themselves with their patient situations or know which colleagues to ask for support. Instead of money going into the pockets of for-profit agencies at a significantly higher cost to taxpayers, we need to be creating permanent nursing positions and investing in strategies that recruit and retain nurses in our public healthcare system. We need transparency about the profits that these agencies are making and about the pay for the staff themselves. Nursing agencies are unregulated, and they are not overseen in a manner that safeguards patient safety or addresses predatory hiring practices, and they certainly don't ensure a value for money. Our healthcare system is facing a variety of complex challenges at the moment, and while I must acknowledge the government's efforts to work to hire and retain more nurses, we have much more to do to retain the dedicated professionals already in our system. This bill is another step in the right direction, and I hope all parties will work together to ensure that nursing agencies are regulated appropriately.
Thank you very much. And I want to echo that sentiment. We've seen a lot of efforts on the part of the government to recruit more nurses, but what has really been missing has been any sort of effort to retain those nurses. And in the wake of that, that's how we've seen the proliferation of these temporary for-profit nursing agencies. And the impact that they have had on our healthcare system is monumental. They face almost no regulation, pull nurses out of public healthcare, and charge a 300 to 400% markup, resulting in runaway spending. In 2020 to 2021, hospitals reported spending nearly $39 million on agency nurses. Within a year, that cost had exploded to nearly $174 million. And that's just in hospitals. This situation continues to accelerate in areas such as long-term care and home care, where we know it is actually a bigger problem. And finally, before I take a moment to describe actually how the bill will regulate temporary nursing agencies, I wanted to highlight something. In 2022, August, Minister Jones had said in the government's healthcare plan, Your Health Act, that they would look at regulating temporary nursing agencies. That was in August 2022. We have seen zero action ever since then. On March 1st of this year, Paul Calandra had said he would bring together a technical advisory committee, again with his deputy minister, to look at temporary for-profit nurse agencies. 7 months later, absolutely zero action. And yet we see an increasingly dire situation in our home care agencies, long-term care home sector, and in our hospitals. And so we're going to step up and we're going to take action. The bill that I present today has common sense solutions that level the playing field for our healthcare system and stops the current system of runaway profiteering. If passed, my bill would require agencies to simply obtain an operating license, and that license would be issued by a qualified registrar who ensures that certain terms and conditions are met. These are very basic, very common sense, and in my opinion, very simple. These terms and conditions would require an end to predatory recruiting practices, like hiring nurses out of parking lots as they leave their work in a long-term care home or in a hospital. It would eliminate price gouging using a principle called unconscionable pricing. And while that may not seem like a familiar concept to many people in the public, it is the exact principle that this government used to eliminate price gouging during the pandemic for things like PPE. And so there's nothing about this strategy that should at all be unattractive or unpalatable to them. The bill will ensure that nursing agencies it will prevent agencies from recruiting nurses from hospitals, only to contract them right back as agency staff. And I want to take a moment to highlight what this actually looks like. Imagine that you are a nurse working at a hospital. You can, under the current environment, they could be enticed to quit their job in a public hospital, immediately work for a private nursing agency, and get brought back the very next day, but at a cost to the hospital that is 3 to 4 times the actual cost of just hiring them permanently. And finally, this bill will increase transparency measures and increase public accountability. So as you can see, Bill 67, the Temporary For-Profit Nursing Agencies Regulation Act, is a very fair, very logical way of reining in these agencies. It's based upon wide consultation with industry stakeholders, healthcare workers, and policymakers. And it is simply intended to level the playing field and ensure that our public healthcare system and taxpayers get good value for money while we're fair to everyone and ensure that patients and healthcare workers are treated with the dignity and respect that they deserve and without holding our hospitals and healthcare system hostage. With that, we're happy to take your questions. Great. Thank you very much.